Hello friends. You all commented so much that we had to postpone all other videos and bring this video about anxiety treatment just for you. Before this video, we had uploaded another video on GAD, which stands for Generalized Anxiety Disorder. In that video, we explained the difference between normal anxiety and GAD and also discussed 20 symptoms. I hope you all have already watched that video. If not, you can click on the I button here or check the link in the description. Now let's discuss what we are going to do in this video. In this video, we will tell you about the treatments for those same 20 symptoms. We have divided the treatment into 3 main parts. First, we will discuss home remedies, then the various CBT techniques, and finally, dietary interventions, which means the kinds of food that can help you. Friends, believe me, this is very important. People often ignore it, but you shouldn't. So, without any delay, let's get started and look at our first symptom, persistent worrying. As I mentioned earlier, the treatment is divided into 3 parts: home remedies, CBT techniques, and dietary interventions. Let's first take a look at the home remedies. Symptom 1, persistent worrying home remedies, such as herbal tea. Herbal teas like chamomile relax the nervous system, reducing stress and helping you feel calmer. Next, aromatherapy. Lavender oil in a diffuser can soothe the mind, promoting relaxation and reducing the cycle of constant worrying. Now, looking at CBT techniques, such as thought challenging. This method involves identifying negative, irrational thoughts and challenging their validity, helping reduce the impact they have on your mood. Next, mindfulness-based CBT focuses on present moment awareness, reducing worries about the future by keeping your mind engaged with the here and now. Now, looking at dietary improvements, such as magnesium-rich foods. Magnesium helps regulate neurotransmitters, which in turn can calm your nervous system and reduce anxiety. Next, vitamin B complex. B vitamins are crucial for brain health, helping improve mood and reduce symptoms of anxiety by stabilizing the body's stress response. Symptom 2, restlessness. Home remedies, such as physical activity. Engaging in physical activities like yoga or walking can release endorphins, improving your mood and reducing physical tension. Next, relaxation techniques. Techniques such as deep breathing or progressive muscle relaxation directly combat physical symptoms of anxiety and restlessness. Now, looking at CBT techniques such as behavioral activation. By staying active and engaged in enjoyable activities, you can distract yourself from anxious feelings and increase positive emotions. Next, relaxation training. Systematically teaches you how to relax, decreasing the overall level of tension in your body. Now, looking at dietary improvements, such as avoid caffeine. Reducing caffeine helps lessen jitteriness and hyperactivity, making it easier to remain calm. Next, omega-3 fatty acids. These are known to reduce inflammation and promote better brain health, leading to decreased anxiety levels. Symptom 3, fatigue. Home remedies such as adequate sleep. Regular sleep not only restores energy but also regulates mood and stress, crucial for managing anxiety. Next, gentle exercise. Low-intensity exercise can boost energy levels and clear your mind, combating the lethargy often associated with anxiety. Now, looking at CBT techniques such as energy conservation. Strategically planning your day to manage energy effectively can prevent burnout and reduce stress-related fatigue. Next, scheduling activities. Balancing rest and activities throughout your day can help maintain consistent energy levels and reduce anxiety. Now looking at dietary improvements, such as iron-rich foods. Iron is vital for energy production. Consuming sufficient iron can combat fatigue, improving overall energy and mood. Next, stay hydrated. Proper hydration is essential for optimal brain function and energy, both of which can be compromised by anxiety. Symptom 4, concentration problems. Home remedies such as focus tasks, engaging in tasks that require focus, like puzzles or reading, can improve concentration and reduce anxiety-induced distraction. Next, meditation. Regular meditation improves focus by training your brain to concentrate on a single object or thought. Now, looking at CBT techniques such as cognitive restructuring, helps identify and change distracting thoughts that impair concentration. Next, Mindfulness techniques. Increases awareness of the present moment, enhancing your ability to focus on the task at hand. Now, looking at dietary improvements, such as omega-3 fatty acids. These nutrients enhance brain function and are crucial for improving focus and mental clarity. Next, complex carbohydrates. Steady blood sugar levels, maintained by whole grains, help sustain mental focus. Symptom 5. Irritability. Home remedies, such as regular exercise, physical activity reduces stress hormones, which can decrease irritability. Next, relaxation techniques. Techniques like yoga and deep breathing can help manage mood swings and irritability. Now, looking at CBT techniques such as emotion regulation, teaches methods to control and express emotions in a healthier way. Next, stress management training reduces the overall emotional response to stress, curbing irritability. Now, looking at dietary improvements such as avoid high sugar foods, reducing sugar intake can stabilize mood swings. Next, B vitamins. These vitamins play a role in managing stress and are essential for mood regulation. Symptom 6. Sleep problems. Home remedies, such as sleep hygiene, establishing a regular bedtime routine and ensuring a comfortable sleep environment. Next, herbal teas, drinking caffeine-free herbal teas like valerian root or chamomile before bed. Now, looking at CBT techniques, such as CBT for insomnia, specifically targets behaviors and thoughts that disrupt sleep. Next, relaxation training helps reduce physical tension and quiet the mind for better sleep. Now, looking at dietary improvements, such as magnesium and calcium, both minerals help the brain use tryptophan to produce melatonin, the sleep hormone. Next, avoid caffeine and sugar. Limiting these before bedtime can prevent sleep disturbances. Symptom 7. Muscle tension. Home remedies, such as warm baths. Soaking in a warm bath with Epsom salts can relieve muscle tension. Next, massage. Regular massage therapy helps reduce overall body tension and stress. Now, looking at CBT techniques, such as progressive muscle relaxation, teaches you to relax muscles through a two-step process. Next, biofeedback. Uses sensors to monitor muscle tension and teaches you to control it. Now, looking at dietary improvements, such as magnesium. This mineral is crucial for muscle relaxation and can be found in nuts, seeds, and leafy greens. Next, hydration. Staying hydrated helps keep muscles functioning properly and prevents cramping. Symptom 8. Excessive worry about health. Home remedies, such as journaling. Writing down your health worries can help you understand and manage them more effectively. Next, relaxation techniques. Practices like guided imagery can help divert your mind from excessive health worries. Now, looking at CBT techniques, such as exposure therapy. Gradually and repeatedly expose yourself to the concept of health issues in a controlled way to reduce fear. Next, cognitive restructuring. Identify and challenge the irrational beliefs about health that cause anxiety. Now, looking at dietary improvements, such as antioxidant-rich foods, berries, nuts, and vegetables help reduce oxidative stress, which can be elevated by chronic worrying. Next, herbal teas. Teas like peppermint and ginger can soothe the stomach and reduce stress, helping to alleviate health-related anxieties. Symptom 9. Avoiding social situations. Home remedies, such as social skills training. Practice social scenarios at home or with a trusted friend to build confidence. Next, mindfulness meditation. Helps reduce the anxiety associated with social interactions by focusing on the present. Now, looking at CBT techniques, such as systematic desensitization. Gradually increase exposure to social situations to reduce fear and anxiety. Next, social skills training. Enhance social skills through role-playing and feedback, which can decrease social avoidance. Now, looking at dietary improvements, such as omega-3 fatty acids, fish like salmon can improve mental health and reduce anxiety symptoms. Next, complex carbohydrates. Maintain a steady blood sugar level with whole grains to keep your mood stable. Symptom 10. Increased irritability. Home remedies, such as physical activity, regular exercise such as jogging or cycling can help release pent-up energy and reduce irritability. Next, essential oils. Aromatherapy with essential oils like chamomile or lavender can calm the mind and reduce mood swings. Now, looking at CBT techniques, such as emotion regulation therapy, learn how to better manage and respond to intense emotions that lead to irritability. Next, mindfulness practices help in recognizing and controlling the impulsivity that often accompanies irritability. Now, looking at dietary improvements, such as magnesium, include foods like bananas and leafy greens, which help in muscle relaxation and mood regulation. Next, low caffeine. Reducing caffeine can decrease irritability as it lowers anxiety and restlessness levels. Symptom 11. Panic attacks. Home remedies, such as breathing exercises. Practice deep breathing techniques to help control the rapid breathing that accompanies panic attacks. Next, grounding techniques. Techniques such as the 5-4-3-2-1 method can help distract the mind and bring attention back to the present. Now, looking at CBT techniques, such as panic control therapy, focuses on exposing patients to the physical sensations of panic in a safe, controlled environment to reduce fear of panic attacks. Next, cognitive restructuring helps identify and challenge the fearful thoughts that trigger panic attacks. Now, looking at dietary improvements such as magnesium helps regulate nerve and muscle function, which can be beneficial during panic attacks. Next, green tea contains L-theanine, an amino acid that promotes relaxation and helps reduce the frequency of panic attacks. Symptom 12. Difficulty making decisions. Home remedies, such as mind mapping, use mind mapping tools to visually organize thoughts and options, helping clarify decisions. Next, meditation reduces stress and clears the mind, aiding in more focused decision-making. Now, looking at CBT techniques, such as problem-solving therapy, teaches systematic decision-making skills and how to break down tasks into manageable steps. Next, cognitive restructuring helps to challenge perfectionism and fear of making wrong decisions. Now, looking at dietary improvements, such as zinc, crucial for cognitive function and decision-making, found in meats, nuts, and seeds. Next, B vitamins enhance brain function and resilience under stress, available in whole grains and dairy products. Symptom 13. Fear of making mistakes. Home remedies such as positive affirmations use affirmations to build self-esteem and reduce the fear of making mistakes. Next, visualization. Imagine yourself succeeding and handling mistakes gracefully to build confidence. Now, looking at CBT techniques such as exposure therapy. Gradually expose yourself to small mistakes to learn they are manageable and not catastrophic. Next, cognitive restructuring helps change the catastrophic thinking pattern that mistakes lead to disaster. Now, looking at dietary improvements, such as omega-3 fatty acids, supports brain health and cognitive flexibility, helping you better adapt to errors. Next, herbal teas. Chamomile or passion flower tea can reduce anxiety and calm nerves when fearing mistakes. Symptom 14. Feelings of worthlessness. Home remedies, such as journaling. Writing down your thoughts and feelings can help process emotions and combat feelings of worthlessness. Next, positive self-talk. Replacing negative thoughts with positive affirmations to build self-esteem and self-worth. Now, looking at CBT techniques, such as self-esteem therapy, focuses on identifying negative self-beliefs and replacing them with more positive ones. Next, assertiveness training helps individuals assert themselves in social situations, boosting self-confidence. Now, looking at dietary improvements, such as protein-rich foods. Foods like fish, chicken, and legumes provide the amino acids needed for neurotransmitter function, supporting brain health and mood. Next, vitamin D. Exposure to sunlight and consuming vitamin D-rich foods like eggs and fortified milk can improve mood and self-esteem. Symptom 15. Obsessive thinking home remedies, such as mindfulness meditation, helps in staying present and reducing the overthinking cycle. Next, scheduled worry. Time. Allocating a specific time for worrying can contain obsessive thoughts to a particular part of the day. Now, looking at CBT techniques, such as cognitive restructuring, aims to change the pattern of obsessive thoughts and reduce their intensity. Next, exposure and response prevention, ERP, specifically effective for obsessive thoughts by gradually exposing individuals to the source of their anxiety and teaching them to refrain from the compulsive response. Now, looking at dietary improvements, such as omega-3 fatty acids found in fish oil and flax seeds, these can help regulate neurotransmitters linked to mood and anxiety. Next, complex carbohydrates stabilize blood sugar levels, which can influence mood and help manage anxiety. Symptom 16, sensitivity to criticism. Home remedies, such as reflective listening, practice active listening without immediate reaction to understand the context better and reduce sensitivity. Next, affirmations. Reinforce personal value and resilience against criticism through positive affirmations. Now, looking at CBT techniques, such as social skills training, enhances understanding of social interactions and reduces the perceived threat of criticism. Next, cognitive restructuring. Helps modify the perception that all criticism is negative or personal. Now, looking at dietary improvements, such as magnesium, found in nuts and leafy greens, it helps in managing stress and calming nerves. Next, B vitamins support stress management and overall brain health, aiding in emotional resilience. Symptom 17, need for reassurance. Home remedies, such as self-soothing techniques. Develop personal methods to calm and reassure yourself, such as listening to soothing music or engaging in a hobby. Next, positive affirmations. Regularly practicing positive affirmations can boost confidence and reduce the need for external reassurance. Now, looking at CBT techniques, such as independence training, teaches skills to foster self-reliance and reduce dependency on others for reassurance. Next, cognitive restructuring. Addresses and modifies the beliefs that underlie the need for constant reassurance. Now, looking at dietary improvements, such as foods rich in omega-3 fatty acids, such as salmon and walnuts, which support brain health and emotional stability. Next, probiotics. Yogurt and other probiotic-rich foods can improve gut health, which is linked to mood and anxiety regulation. Symptom 18, perfectionism. Home remedies, such as scheduled breaks. Incorporate regular breaks during work to prevent burnout and reduce perfectionistic tendencies. Next, mindfulness practices. Engage in mindfulness to accept things as they are, not as you feel they should be, helping to mitigate perfectionism. Now, looking at CBT techniques, such as setting realistic goals. Work on establishing achievable goals instead of striving for perfection, which is often unattainable. Next, exposure therapy. Gradually exposing oneself to making minor mistakes can help decrease the anxiety associated with imperfections. Now, looking at dietary improvements, such as magnesium, helps to relax the nervous system and can be beneficial for those who experience anxiety from perfectionism. Next, antioxidant-rich foods. Berries, nuts, and green vegetables can help combat oxidative stress associated with chronic anxiety. Symptom 19, avoiding tasks. Home remedies, such as task structuring. Break down tasks into smaller, more manageable steps to reduce overwhelm and avoidance. Next, reward system. Set up a system of rewards for completing tasks which can motivate you to tackle and not avoid responsibilities. Now, looking at CBT techniques, such as behavioral activation, encourages engagement with feared tasks in small, manageable doses to reduce avoidance behaviors. Next, problem-solving skills. Enhances the ability to cope with tasks by developing effective problem-solving strategies. Now, looking at dietary improvements, such as complex carbohydrates, foods like whole grains provide sustained energy, which is necessary for tackling tasks throughout the day. Next, lean proteins, such as chicken and beans, which can provide the energy needed to face challenging tasks. Symptom 20, excessive planning. Home remedies, such as meditation, helps in reducing the need to overplan by promoting a state of mind where one can comfortably handle uncertainties. Next, journaling. Writing down plans and reflections can help understand the reasons behind excessive planning and work towards moderation. Now, looking at CBT techniques, such as mindfulness training, teaches how to live in the moment rather than excessively worry about future plans. Next, cognitive restructuring. Helps change the thought patterns that lead to the need for excessive planning. Now, looking at dietary improvements, such as B vitamins, important for energy and coping with stress. found in whole grains, meats, and eggs. Next, green tea contains theanine, which can help relax the mind and reduce the urge to overplan. So friends, those were some of the main symptoms of GAD and effective ways to manage them. Everyone is different, and so can be their treatment. If you see these symptoms in yourself or someone you know, do not hesitate to seek professional help. Remember, your mental health is just as important as your physical health. Thank you for watching this video. If you found this video helpful, please like it, share it, and if you haven't subscribed to our channel yet, do subscribe now so you can watch more useful videos. Take care of yourself, stay happy, and stay healthy. Thank you.